want to go to type in no barrier. So I'm going to share screen so you can just read it off. Yeah. Yeah. So no barrier is NOBARRIER .ai. It's not .com. And then if you click on log in, what they've told us that you should be able to log in just putting in your Avail email address. That it'll open it up for you. So if you can go ahead and I'll give you a minute to get logged in. Yeah. So I'm already logged in, so I'm going to kind of walk you through. There's a demo that you can go through, and let me give you context about this. So one of our responsibilities as a healthcare organization, and you're going to laugh when I tell you this because you probably work for multiple that don't actually do this, but you should have access to interpretation if you need it, and you should be trained on it so that you know what you need to do when you need to do it. Now, this is not like a perfect fix for all languages. This system works for 31 languages, and then a few languages, it's multiple different dialects. Actually, the health plan is responsible to provide interpretation services. So if this, we need interpretation and this software doesn't cover what we need, you can reach out to Cindy or me, and we can get in touch with the health plan about what the solution is for that. So I'm just going to go through this workflow. Oh wait, hold on. I've got to record this. I'm so glad I remembered. Oh, I already am recording it. Wow, amazing. So this would happen in the scenario that, right, you go in to greet the patient and they don't understand you, or when they talk to you, you're like, uh-oh. So, find out what is their, primary language, their first language. Now, you've probably seen this before. Some patients who don't speak English, they actually might speak 2 or 3 languages. They just don't speak English. So if you can find a language that they understand, then you can use that. And it works pretty well. So let me sit in here. There it is. Okay, so I'm going to start an encounter. So this is where I get to pick a language. So there's a drop down here, right? So I'm just going to take a minute to go through this because this is really cool. So they have American Spanish, like, which, by the way, is ridiculous that they say that there's a US based form of Spanish, because there's like 30 different kinds of Spanish spoken in the United States, right? Because there are people from all over the Spanish speaking world. And that's just me being annoyed because I speak Spanish, and I meet patients who speak forms of Spanish that it is incredibly hard for me to understand them, right? And it's just so different. So if you've ever heard a Scottish person speak English, that's a good example of what some people sound like in Spanish. It's like, what did they just say? They're talking the same language as me? I don't know what they're saying. So anyways, but you can pick. So, Puerto Rico is one of those that's a little bit hard for me. Dominican Republic, Cuba, Mexican Spanish, that's way more comfortable for me. And when they say up here, they say US, Spanish, US, what they're really showing there is the Spanish flag. So it's actually European Spanish. I don't know why they did that, but ignore that. That's not relevant. Okay, so they have Albanian, Arabic. It's basically it's in alphabetical order. So if you know the name of their preferred language, you just search down through it. But they have enough languages here, it's literally covers about half of the entire global population, that they have already done. And I'm a total geography nerd. So if you ever need help figuring out what language they might speak, I can probably tell you if you tell me where they're from. Anyway, so you pick a language. So I'm going to pick Spanish because then I can be both the patient and the provider. Okay. Now, what's really cool here is that you can pick what voice you want it to have. So do you want it to have a, for women, you might want a female voice, right? For male, you might want a male voice because it's essentially like repeating what you've just said in their language when you use it. Now, you'll notice underneath, so I'm going to pick male. So underneath, there's this thing, advanced settings. Now, you don't have to use this if you don't want to, but what this is like, you're not going to need to use a child voice, right? Because you're not going to be dealing with children. But some people, some older adults in certain languages are much more comfortable with formal than informal language, right? But I think you probably can just stick with, I'd have it defaulted to formal. But people usually know what, it's like someone speaking really proper English to you. You're going to understand what they're saying. You might not speak like that, but that's what it'll sound like to them. So I'm going to use formal, and you'll hear, even if you don't understand Spanish, when it interprets, you'll hear that it's, there's all the words are separate. It's very easy to kind of hear the words spoken. So I'm going to start an encounter, and I want to tell you a little trick here if you're ever going to use it. Hold on, let me let it load. So this might take a minute because, oh, there we go. Okay, so you can, as you start the encounter, it already tees you up to say, you can have a Spanish introduction to the patient, because I picked the Spanish language. So you could press play and it'll say in Spanish, "Hi, I'll be using medical interpreting software to ensure we communicate clearly and that you understand everything about your healthcare. We will talk in turns. Let's start." So let me play it. This is what it sounds like.
Hola, usaré un software de interpretación médica para asegurarme de que nos comuniquemos claramente y de que entiendas todo sobre tu atención médica. Hablaremos por turnos. Comencemos.
Okay, sorry, I was muted there for a second. All right, so I'm going to go ahead and start the encounter. Now, when you're in an encounter, you actually have to click that little microphone to get it to start. And then you have to kind of click it and then stop it. That's one way you can do it. I don't like that way. Notice there's a little circle to the left and it says hands-free. This is going to work way better in the skilled nursing facility. You're going to have it on your device. You don't want to keep having to press start and stop. So I'm going to use hands-free, and what it does is it pauses. So when I finish speaking, it waits about 1.5 seconds, and then it interprets what I've said. And it does the same for the patient. So I'll just show you now. I'm going to use the longer pause. So I just turned it on.
Ahora, simplemente lo encendí.
I'm just pausing for a second. So it actually heard me say, I'm not, it said, I just turned it on now. So then it interpreted that in Spanish. So ignore that. I'm going to restart it now. Hi, my name is Joseph Harris. I'm a nurse practitioner, and I'm actually here to complete a chronic disease assessment to make sure that we understand all of your health needs so that your health needs can be taken care of.
Hola, mi nombre es Joseph Harrison, soy enfermero practicante y estoy aquí para completar una evaluación de enfermedades crónicas para asegurarme de que comprendamos todas sus necesidades de salud, de modo que podamos atenderlas adecuadamente.
Ok, gracias por explicarme, pero ¿de dónde viene? Yo no entiendo, nunca te he visto, pues, ¿qué compañía, de qué compañía viene?
Okay, thank you for explaining, but where are you from? I don't understand, I've never seen you. What company are you from?
Oh, I work with Avail Health, and your health plan has hired me and my team to come in and see how you're doing and understand what your needs are. You still have the same primary care provider, the same nurses taking care of you. We're just here for one visit to get to know you better so that your health plan knows exactly what your needs are.
Oh, Trabajo con Avail Health y su plan de salud me ha contratado a mí y a mi equipo para ver cómo está y entender cuáles son sus necesidades. Usted todavía tiene el mismo proveedor de atención primaria y las mismas enfermeras cuidándolo. Solo estamos aquí para una visita para conocerlo mejor y que su plan de salud sepa exactamente cuáles son sus necesidades.
Oh, ok. Ahora entiendo. Gracias por visitarme. ¿Cuáles preguntas tiene para mí?
Oh, okay, now I understand. Thank you for visiting me. What questions do you have for me?
Okay, I'm going to stop there, but you essentially see the workflow. And when I picked that hands-free, it was so natural, right? Like I don't have to, I just start the thing and I just have to make sure I pause when I finish speaking. I don't want to keep talking because then it's going to keep waiting for me to stop talking to start interpreting what I'm saying. And a lot of, folks who don't speak Spanish, English, this will not be as novel to them as it is to us, right? They'll be used to having had interpretation at some point in their life. What will be new is that it's a computer doing it, right? And so, we might need to explain that to them. They're like, wait, what's going on? Who is that person that's interpreting for me? And you can just explain, it's actually the computer does it for us, right? Anyways, so I hope you find, I saw that comment from Isata that it's cool, right? Because depends on what setting you work in, but some settings, there's just tons of people who don't speak English as a first language, right? And it's really often a barrier. They don't have the same outcomes because we don't understand them as well. So we don't, know what they need as well. So anyways, so that was pretty fast. Anybody have any questions about that? Anybody who speaks a different language want to demo it for us? I know we've got people on here that speak some languages other than English. Wait, let's test that out. Should we test it out? Do you want to you'll be the clinician and I'll be the Spanish speaking patient?
Will you be able to tell what it says?
Well, you can come sit next to me and you can do the clinician part and I'll do the patient part and we'll see if it has trouble. If you didn't hear that, we were just talking about, does the AI understand like English accents, right? Like people speaking differently because of their region or whatever. All right, here we go. So I got to start this over. So I'm ending the encounter. Oh, I should have shown you all this. So, so I'm going to create notes here. And what's really cool, you can probably see, is it actually gives you the whole conversation, but in English, right? So you could actually then copy and paste this into your clinical note without having to type it all. And that's just simply clicking on the little copy thing, and then you go over to your clinical note and you click paste, and it'll load in there. But anyway, so let's start a new encounter. Oh, sorry, there we go. Patient gender, male, advanced settings, adult, formal.
Your liver tests show elevated enzymes suggesting possible hepatobiliary issues.
Sus análisis de hígado indican enzimas elevadas, lo que sugiere posibles problemas hepatobiliares.
Yo no entiendo qué quiere decir problemas hepatobiliares.
I don't understand what hepatobiliary issues mean.
It's problems with your liver.
Son problemas con su hígado.
Ay, 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 ¿qué pasa con mi hígado?
Oh no, what's happening with my liver?
We'll send you to a liver specialist and let them evaluate. Right now, we're just seeing elevated liver enzymes.
Lo enviaremos a un especialista en hígado para que lo evalúe. Por ahora, solo estamos viendo enzimas hepáticas elevadas.
Oh, Dios mío. Oh, Dios mío, que me ayuda. No sé. ¿Voy a sobrevivir o no? ¿Cuántos días tengo?
Oh my God, help me. I don't know, am I going to survive or not? How many days do I have?
All right, we can pause there. Thank you for being a guinea pig. I think the software
Okay,
was
we
able
can
to,
pause there.
I think the software was able to understand you just fine. And what was really cool, if you didn't pick up on this because you don't speak Spanish, is that I was using kind of colloquialisms, like ways that people would express themselves that are, I didn't say, oh no, I said, ay, 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 right? But it understands that and it turns it into what I might say in English, right? Which I think is so cool. Yeah, of course. All right, so if you haven't already logged in, you should be able to get in there just fine. And you don't need to be in there unless you need to be in there, right? But I was recording this just so it can be a resource for you, in case you don't remember. But when you log in the first time, there's actually a demo, and it walks you through the whole thing, and it's so straightforward. So I think just doing the demo itself yourself and not just